Very first thing that we will be talking about is the melanocytic nevus pigmented nevus nodes. So what it is a congenital or acquired melanocytic neoplasm. Commonly, it is also called as moles. It is well demarcated, uniformly tan brown papules of less than or equal to 6 mm in. Then it has several variations like it has congenital nevus, blue nevus, spindle and epithelioid cell nevus, halo nevus, and dysplastic nevus. Then we need to understand about the pathogenesis. So many nevus have the acquired mutation in BRAF or the NRAS that are gene involved in the RAS signaling that leads to a limited period of proliferation followed by a permanent growth and arrest in most of the cases. It is due to the accumulation of P16 or INK4A, that is the inhibitors of CDKs. Now, what is the morphology? Very, very hypopigmented, not hyperpigmented. It will be very, very hypopigmented. And there will be a wide space between both the eyes. There will be a wide space between both the eyes. And both will have different colors, although in this image we are not able to appreciate it that well. But both of the eyes will have different colors. And there will be a congenital hearing loss. Now, patchy hypopigmentation, that is nothing but the phleboldism. Okay. Mostly it is located in the cutaneous part, that is the face and the scalp. What is the significance of it? It is associated with the hereditary disorders like the von Hippel-Lindau syndrome, that is on the chromosome number 3. Okay, so you can remember it like VHL. VHL has 3 letters, so it is chromosome number 3. Then you have the Sturge-Weber syndrome, and they may grow with the child, but most hemangiomas regress spontaneously. This is nothing but hemangioma. They are flat, elevated, and red-blue masses.
Is every mole on your skin actually safe? A melanocytic nevus is simply a common mole. They form from melanocytes, the pigment-producing cells. Moles can be flat, raised, or a combination. But not every mole is harmless. It's important to always remember the ABCDE rule for mole safety. If it's asymmetrical or has uneven borders, if the color varies or the size increases, if it keeps changing over time, take it seriously. When in doubt, get it checked early.
Retinoblastoma, so it is the most common malignant eye tumor of the childhood. It is an unusual tumor. It occurs as a congenital tumor. It can be multifocal or bilateral depending on the condition. And it occurs in 2 patterns, that is sporadic and familial. If it occurs in familial pattern, so it will be autosomal dominant inherited disease. And in the sporadic one, there will be inactivation of both the retinoblastoma suppressor gene. Clinical features, there will be poor vision and pain in the eye, and there will be something by the name of white eye reflex. That is nothing but leukocoria. And if this tumor is untreated, it will be fatal. Retinoblastoma, it is a nodular mass in the eye that replaces in the vitreous part. So it is small rounded blue cells with large nuclei that we are able to see in the microscopic images. That is the characteristic structure. Okay, it consists of cluster of the cuboidal cells that are arranged around the central lumen. Now, next is the skin manifestation of the systemic disease. First one, you have the diabetes mellitus. So in the diabetes mellitus, there will be infective manifestations like syndrome. In the Gardner syndrome, it is a variant of FAB. You will be having the GI polyps, multiple osteomas, and skin and soft tissue tumors. Peutz-Jeghers syndrome, as I was telling you, see the lips of this child. What you are able to see that there is a lot of pigmentation. So there will be melanocytic macules that usually appears before 5 years of age and may fade after the puberty.
These are not just simple pigmentation spots. You need to watch these signs very closely. Hidden deep inside your gut. Polyps that you simply can't see. Symptoms can be silent or sudden. This genetic condition runs in families. This is the real danger. Please don't ignore these important signs. Regular checkups help you stay one step ahead, because even the smallest signs really matter.